I'm Dr. Joel Kopelman. I'm a facial plastic surgeon in Manhattan on Park Avenue. And today I'm going to discuss eyelid lifts, or what is medically termed a blepharoplasty. This is a procedure that has long-lasting improvement on the upper eyelid contours and aesthetics. That is a simple procedure that has a very low risk profile associated with it. So what exactly is a blepharoplasty? Well, it is basically just removing a little strip of upper eyelid skin and sometimes some redundant upper eyelid muscle and some bulging inner corner fat that can occur as we age. Very occasionally, we move this fat from the inner corner to the center of the eyelid when there's hollows in the upper eyelid. What is critical about this procedure is the evaluation prior to the surgery that makes a successful result. So what exactly goes into that evaluation? Well, when you go to your doctor, they have to take into account your age, your ethnicity, your gender, all those things, along with the degree of laxity of the upper lid and other factors that may impinge on the eyelid, like the brow descent. After we cover the physical evaluation, we then delve into your medical history. Are you on any blood thinners like aspirin, Advil, Motrin, vitamin E, fish oil? All those things can impact whether or not you're going to develop swelling and bruising following the procedure. Next, we look at each individual and we try to customize this plan in our heads before we proceed. It's so important to think out every little step so that we end up with a successful result. The procedure itself is relatively simple. Before we start surgery, however, we have to decide what kind of anesthesia you want. Some people want to go to sleep and be totally in a la-la land, which would mean IV sedation would be given to the patient with an anesthesiologist monitoring the anesthesia, or sometimes people opt to just have a local anesthesia and take a sedative like Valium prior to the procedure. On the day of the surgery, you'll come in, you'll get dressed in a gown, you'll be placed in the operating room in a sterile environment, and measurements are made very precisely with a measuring device called a caliper, which measures the exact amount of skin that's going to be removed on both upper lids. So you get measurements very precise so that you end up with a symmetric result. Also, the areas where fat is going to be removed is also outlined in order to make sure we get symmetric amounts of fat removal. After these measurements are made, an injection of lidocaine, which is like Novocaine, is performed underneath the skin, and that numbs the area. You won't feel anything. It'll be totally painless. The incision is then made from the inner corner to the outer corner with a blade, and a strip of skin is removed. There's a little cautery that takes place to close off any little bleeding vessels. And then the eyelid is closed with a running stitch. I use a non-absorbable suture. After surgery, the sutures are external on the eyelid. They do not scratch your eye. After approximately 5 days, these sutures are taken out. In terms of resuming your activities, you can go and walk and do anything you normally would do a day after surgery. But we don't want you to do rock climbing and do other things that would jeopardize the surgery. So you have to have good judgment and good common sense, of course. The results of this procedure are long-lasting. Patients, even 10 and 15 years after I've performed this procedure, come back, they still look refreshed, more youthful than they did prior to the procedure. Of course, with age, things change. You get more wrinkling of the skin and so forth, but the skin, muscle, and fat that are removed on the initial procedure do not recur. What happens with age is that there's some laxity of the upper eyelid skin or descent of your brow, which can show some degrees of aging. But the initial procedure is long-lasting and has a very high satisfaction rate, and patients are very happy even 10 years later. I made this video so you will be able to go to your doctor and ask the right questions about the proposed upper eyelid blepharoplasty. If you have any further questions to ask me, please leave them below. Please subscribe to my channel and I look forward to seeing you again in my future videos.